And 12, thank you. It's 12:01, and I'm going to say hello and Happy New Year to everyone who is here and welcome. And if you can mute thank you, ladies. I'm going to say mute your screen. We would appreciate it. So happy New Year. My name is Nancy Marks Erickson. We're here on behalf of the Women with IBM, um, and hopefully give you a great day. Today with me, I'm lucky. Unfortunately, Sharon and Laura had some problems at the last minute and aren't able to attend, but we are honored to have Martha Arnold and Pam Autry helping us. So we have Texas and Pennsylvania represented today. So here we are. Our program today, I think, is something that all of us need. It's a guided conversation about IBM and physical therapy, why it works, and how do we use it. As we know, our physical therapy is our prescription. So, as you all know, IBM, our Women with IBM's motto is to improve the lives of women affected by inclusion body myositis through virtual connections and support to transcend geography. How this happens. Whoops. We build and create a sense of community amongst women with IBM. We network and collaborate. We share our ideas to thrive with IBM. We obtain information from professionals in the field, as we do today. We find joy and hope amongst this journey, and it happens by creating a safe and welcoming environment, privacy for sharing, and vulnerability without fear of judgment, while valuing the experiences of one another. So, a little bit of Zoom etiquette. Thank you for being here. Please remain muted until acknowledged and use the video when possible. Avoid multitasking. So here we are, our welcoming guidelines for our agenda. And the topic, as I said, is IBM and physical therapy, why it works and how to use it. I'll introduce our speaker who we're honored to have. Then we're all going to go into a breakout session. And after the breakout sessions, we will report back with everything that happened in there so that we can have our comments and questions answered by our professional. Then, of course, the summary and looking ahead at future meetings. So with that, we are honored today to introduce Clarisse Labor, who is a doctor of physical therapy, um, physical therapist, and Clarisse, I don't know the what all of her other abbreviations mean, but she has been a dedicated physical therapist for over 25 years across healthcare settings, both in hospitals, skilled nursing facility, and home care, which some of us need. She has a specialized expertise in outpatient orthopedics and works with a clientele ranging from elderly individuals to young athletes. She's able to provide physical therapy services and conducts, which is important for us, home safety evaluation to support people like us in maintaining our independence. She is a certified aging in place specialist and helps make individuals make safe and practical home modifications to enhance their mobility within their living spaces. Clarisse is an active, is an has active involvement in professional organizations, particularly the American Physical Therapy Association, APTA, where she is chair of the Diversity, Equity, and Inclusion Committee's mentorship program and director of committee engagement for the Maryland chapter of APTA. She serves as the Maryland representative for PT Moves to Me to increase diversity within the PT profession through clinical work, advocacy, and mentorship. Clarisse remains committed to improving lives and fostering inclusivity within healthcare. And my mouth's a little dry today. So with that, I'm going to introduce you to Clarisse. Clarisse, do you want to unmute and I can, you should, and take control of the screen?
Sure, definitely can. Good. Well, I guess it's good afternoon. It's good afternoon from Maryland here, but I know we have people from across the country. So I know that it might be good morning or good afternoon to you, but I'm just so happy to be here. Thanks, Nancy, for that introduction. But I'm just happy to be here today to talk a little bit about physical therapy and how it works, why does it work, and just the importance of it for all of us. I'm not sure if we have any Marylanders here, but you can give a shout out on the chat. If you're in Maryland, I work out of Bowie, Maryland, which is in Prince George's County in Maryland. And like Nancy had mentioned, I've worked in a lot of different settings, from home health to outpatient to inpatient care. And worked in a lot of different levels. But I just wanted to kind of give a brief overview a little bit. And I'm going to share my screen here in a minute, and then we'll break out into the breakout rooms and be able to answer more questions that you all may have as well. So let me share my screen here.
Oh. Clarisse, also, I incorporated yours in this, if you'd like.
Oh, you did? Perfect. So
Yeah.
I don't even have to, okay, perfect. So then I don't even have to, okay. Well, then let me, all right. So then I can just go right on. So then,
on this goddamn thing. Yeah.
okay, so let me cancel that out.
As we go through technical, I can also just click on things for you if you like. It's up to
Sure.
you.
Will it forward? I was trying to forward through the screen.
Okay, here we go.
Okay, here we go. All right, perfect. All right, so inclusion IBM. So obviously I know that we all know what that is. So everybody that's on the call has this, but so inclusion body myositis is a late onset inflammatory muscle disease. It's a myopathy. It's associated with aggressive proximal and distal limb muscle atrophy and weakness. And then obviously the treatment options have attempted to target inflammatory and atrophic features of this condition. All right. So when we're talking about the IBM, how does it present? As most of you know, most of the time the weakness is asymmetrical. So basically it's usually one-sided. It can be both-sided, but a lot of times it might present on just one side of the body. Some of the things that you'll a lot of times will see will be would be quadriceps weakness. So your quadriceps are the muscles in the front of your thigh. So you'll see that might become weak, as well as the fingers. I know a lot of people have issues with their fingers, and it particularly affects the finger flexors. So that's what's used to help items, hold on to items, opening up jar lids. And then some people might also have weakness of the dorsiflexors, and the ankle dorsiflexors are the muscles in front of the lower legs that helps you pick up your foot when walking. So when people have this issue, sometimes they have an issue with kind of misstepping, and then it can also cause them to fall. And I know there was a question about some of the some different devices that you can use, AFOs, and I'll talk a little bit about that. They can help when somebody has significant issues with their ankle dorsiflexors. So what are some of the functional deficits that you'll see? So someone may have a difficult time climbing steps, difficulty getting up from a chair. And usually that's from the weakness of the quadriceps muscles in the front of the thigh. So when you're doing therapy, we definitely usually work a lot on that. When you're talking about issues with the hands, people will have difficulty, like I mentioned, opening jars, holding on to items. And then occasionally you'll have people that when the disease becomes more progressive can have issues with dysphagia or the difficulty with swallowing. So what are some of the goals of therapy? So with physical therapy, for those who haven't had it yet or who have had it, as physical therapists, we are doctors of movement. So we know how the body moves. So we are going to look at what are the deficits that you might have in your muscles. So we're going to look at maintaining your muscle strength. We're going to look at endurance of those muscles and just overall endurance and oxygen capacity of how you can move. We also work on improving balance and minimizing falls. So we know this with some of the deficits, whether it's the quadricep muscle, which is that muscle in the front of the thigh, or those ankle muscles that sometimes can become weakened with IBM, that can cause you to be more prone to falls. And so we work on all these different things to help minimize falls. We also can work on joint flexibility and range of motion. So as the disease can become progressive as well, sometimes people will have issues with gripping, and it affects the flexors on their hands. And so we want to work on making sure that you keep the mobility in those fingers, as well as the legs, as well as the general flexibility. And with all of that, we're working on promoting independence and quality of life, right? We're working on all these different things to help individuals function and move better. So there is, I will say there's not a lot of research. We definitely have to do so much more research. But the evidence-based research that we do have, it does help to slow the progression of muscle weakness, as well as helps to maintain the muscle strength that you already have. It can also, physical therapy helps to improve cardiovascular health, and then can also reduce the risk of secondary complications, which can be the contractures. And the contractures is when their muscles are really tight and they're not able to straighten or bend. So what are some basic general exercise guidelines for IBM? So with strengthening of the muscles, we want to maintain the residual strength of the weakened muscles. In particular, like I said, a lot of times people have weakness of their quadricep muscles, their ankle dorsiflexors, and then in their hands. We can also, you want to focus on exercise that improve endurance. That's going to be able to help with your daily activities and daily things that you need to do. But also, we know that exercise also just helps with general mental health. So as you're working with exercises, just exercises in general helps to increase endorphins, which are kind of those mood boosters that we all have. So it can help with that. It helps reduce feelings of frustration and depression. And so I think with exercise in general, it can just help you make you feel better. The other thing too, it helps to prevent secondary issues. So like we talked about that stiffness that some people will have, and then just overall cardiovascular deconditioning, which can help with your normal daily activities. All right. And so when we're talking about exercise programs for IBM, usually the focus in physical therapy is to try to do things that are individualized to you. And I can't emphasize that enough. And that's why I think it's so important to be able to seek out a physical therapist who can help you individually, and they can look at what are the things that are deficits for you as an individual, right? So everybody, people will kind of present in a general form, right? They're going to have generally weak muscles, specifically the quads and some other different things. But when you visit a physical therapist, they can tailor your exercise program for you and what your deficits are, okay? What they also would do in general is a lot of times you want to focus on low intensity functional exercise program. They would also work on progressive aerobic exercises, low intensity, high repetition. So a lot of times we'll start off doing more. And what I mean by low intensity is you're not going to go out and run 5 miles, right? But you're not going to go out and lifting 100, 200 pounds of weight. So you're going to start with the lower intensity, but have higher repetition of the exercises. Again, this is also talking about tailoring the program to individual needs. That therapist will be able to take a look at you, look at your personal deficits. What are the muscles that are tight? What are the muscles that are weakened? What are the conditioning things that you need to do? And they should be able to tailor it to you. Okay. And for best results, what they really recommend is daily and regular exercise. So being consistent is also very important. And that's where the therapist will work with you to develop a good home exercise program with you so that when you're not in the clinic, you will know what you need to do at home on your own. So what are some different guidelines, right? So when we talk about aerobic exercises, that walking, it could be cycling, swimming, something that's low impact, water exercises, anything that's basically aerobic exercise, anything that's going to get your heart rate up. And so usually the guidelines that we'll utilize for aerobic exercises that you want to work at 50 to 70% of your resting heart rate. The way that you can find your resting heart rate for your target maximum heart rate for an age, you take 220 minus your age. Whatever that number is, you want to be working out at 50 to 70% of that, of whatever that number is. So let's say the target heart rate for somebody is at 200. If you would want to work out at 100, so half of that would be about 100 to maybe 125 heart rate for that. So sometimes getting either a Fitbit or something that kind of helps to target your heart rate will also help you keep track of that so that you know that you're working in an intensity that's going to really help you. Frequency. So with the aerobic exercises, 3 to 5 days a week, that could be anywhere from 20 to 40 minutes per session. Okay. And I try to tell people that you can build up to that. Sometimes it's hard you might not be at 20 minutes, but maybe you start at 10 and maybe you break it up multiple times a day, right? If you do 10 minutes here, maybe you do 10 minutes in the afternoon, but just trying to work up to building that 20 to 40 minutes of duration of aerobic exercise. You also want to be able to incorporate strength training. So strength training is more like resistive training or muscle strengthening. That can be with light resistance. That could be with bands. You hear people talk about different TheraBands. It could be with light weights. You want to focus on some of the larger muscle groups. And again, this is where working with the physical therapist can help you because they can tell you what are the muscles that you individually need to work on. Just as a general rule of thumb, 2 to 3 sets of 8 to 12 repetitions at 2 to 3 times a week for the strength training. And then the flexibility exercises, that's to help those muscles stay nice and loosened up. So daily gentle stretches for major joints. And when you're doing stretches, usually you want to hold them for 15 to 30 seconds. So just some more general guidelines, focusing on functional exercises. And what we mean by functional exercises are things that you would do on a daily basis. So sitting to stand, we know that sometimes that can be an issue. So practicing doing sit to stand, you're just basically doing repetitive standing up, sitting back down, standing up, sitting back down. That really helps those quadricep muscles that we know they can become weakened. Doing step ups, going up and down steps. That can also help. Wall squats. Those are different things that are going to help with the quads. Even gripping, doing different things with like grippers or putty for hands, that can help with that. Now, when you're in an active flare-up, I always tell people that's when you would want to do definitely more of that lower resistance and then those high frequencies, especially when you're in an active flare-up. If your symptoms are stable and you're not feeling too bad at that moment, sometimes you can actually do a higher resistant and then lower repetitions. But as a general rule of thumb, usually the lower resistance and high frequency is always generally safe for all individuals, whether they're in a flare-up or not. You just may have to tailor it to at what state that you're in. So for the early stages with IBM, what are some of the goals that you want to focus? So this is somebody that's still walking, that's not having a lot of deficits and can still do a lot of things. So you're going to want to maximize your functional strength and endurance to help delay the progression of the weakness. So some recommended exercises is resistive training with low weights and high repetitions. That can also be TheraBands. It can also be weights machines or different weights that you're doing. You want to incorporate some balance and coordination exercises. So we know that sometimes the quad weakness and the dorsiflexor weakness, which helps that foot from not dropping, can reduce the balance and coordination that people may have. So doing any type of exercise where you're standing on one foot, whether making sure that you have something to hold on to just in case, different stepping drills that could be step ups as well, can also help with that balance and coordination. Moderate intensity aerobic exercises, walking, swimming, riding a bike, those are all good to do. And then of course, those functional exercises like we talked about, that sit to stand, squatting, and doing some different things there. And then in the moderate stages, okay, so moderate stages, the goals are to maintain mobility and then also to prevent the secondary complications. So you may have to go at this point to doing more seated exercises. I know some people had asked about some of the questions that I saw was that for chair, what are some chair-based exercises? And there's a lot of different things that you can do in the chair. You can do the band exercises in the chair. You can do leg exercises seated in a chair. So those at this stage, you might be more apt to do some of those different things, arm cycling, like the lower extremity bike. Sometimes people have, you could do those as well. And then stretching routines to help prevent the contractures, which is when those muscles become really tight. And then at this stage too, you may need different assisted devices to help with some of your daily activities. Sometimes the AFO, which is the ground reaction force, and usually the AFO, which is the AFO stands for ankle foot arthrosis. And so that's the brace that somebody would use if they have what's considered a foot drop or where they don't have the muscles in the lower leg to hold their foot up. The AFO that's usually recommended is kind of a ground reaction force AFO. And basically that's the AFO that when you step, it automatically signals for your foot to come up, and the brace itself will help bring that foot up. So that might be something that a therapist or somebody might suggest. And just other adaptive devices that you might need for your hands at this point too. And that might be from actually an occupational therapy. I will say that we do work very closely. It is a multidisciplinary thing. So sometimes if somebody has a lot of deficits with their hands, we definitely recommend occupational therapy because they have they definitely can help you with a lot of the gripping things, a lot of the exercises, and also the adaptive equipment that you might need to be able to help function with your hands better. And so in the advanced stages, so the goals in the advanced stages is basically to help focus on maintaining flexibility and then also preventing discomfort. So this might be someone that, is definitely progressed and they may not, probably at this stage, probably aren't doing a lot of walking at this point. And so sometimes people may have a difficult time just getting in and out of the bed. And so working on bed mobility, and the therapist would be able to show you some different tactics and different things to help you get out of the bed. A lot of times people will have issues with their neck at this stage and holding their neck up. So there are some exercises that you can do to help with neck exercises. And then also some people may have the contractures in their hands. So doing a lot of stretching of their hands and using some different adaptive equipment to help with that too. And then if it becomes very progressive and people have issues with dysphagia or trouble swallowing or breathing, there are some different exercises and stuff that you can do to help with the breathing exercises to support respiratory function as well. During this time too, it's very important to be able to educate not only you as an individual, but also the caregiver and people to help that might be able to help with the stretching and also helping with proper positioning to prevent any skin breakdown, in particular if you're not able to really move very well. And this is where I know sometimes people wonder if somebody gets home therapy. So as a home therapist, we'll see patients in their home that aren't able to leave their home to come to therapy. So we would work with an individual on how they can better get around their house. How can maybe the caregiver help them out at this stage? What are some different positionings that might be able to help them to prevent skin breakdown? And then other guidelines for a home safety evaluation too. So these are again just some general it's essentials and guidelines. When you're exercising, it's always nice to warm up and also to cool down, which helps to prevent injury. You want to monitor your intensity. So we talked about how sometimes if you want to try to get your target heart rate, which is the 220 minus your age, that can get your target heart rate to know if you're exercising between that 50 to 70% of your target heart rate to know that you're really exerting the type of intensity that you would want. Another scale that's here, it's called the Borg scale of preserved exertion, or sometimes people will say RPE, you'll see. And basically with this scale, you can always look it up. It's from 0 to 10. And so on that, it basically just states, okay, how hard are you working? Can you breathe while you're exercising? Can you talk while you're exercising? And they have the different criterias. And on there, you want to 4 out of 10 on that scale to state that, hey, yes, I'm breathing very heavy. And, yes, I'm able to, or am not breathing very heavy, then that's when you can probably increase your intensity a little bit. So using that as a helpful way to be able to help monitor whether you're exercising at a higher intensity level. You definitely want to stay hydrated, right? You want to drink plenty of water to make sure that you're hydrated before and during or after exercise too. And then also just, listen to your body, okay? If you're having excessive pain or excessive fatigue or dizziness, those are the things that maybe you need to stop, or maybe did a little bit too much. But I am going to talk a little bit more about pain and fatigue as well. The role of assistive devices. So as someone becomes a little bit weaker, there are a lot of different things that the physical therapist can help you to attain or suggest. That could be canes, walkers, wheelchairs, to be able to help you stay safe and independent. As far as adaptive equipment, sometimes we'll recommend reachers, grab bars, shower chairs to help you, be able to take showers safely. Sometimes people need elevated toilet seats, and that's also where an occupational therapist can also be very helpful, because they do work with a lot of different adaptive equipment as far as, staying safe in the home. So like I said, we definitely work closely with occupational therapists. And then the orthotics, and we talked a little bit about the ankle foot orthosis and how that can help for somebody who's having a hard time picking their foot up. So fatigue. So we know that a lot of times when people exercise, definitely the muscles, and in particular with IBM, their muscles can become fatigued very quickly. And so why does that happen? So usually if you're going to fatigue one muscle group, a lot of time the other muscles will compensate to help, right? And so then that's where that general overall fatigue can come. And so sometimes you do need to adapt your exercise intensity. And so it's one of those things where I always tell people, yes, you'll become fatigued, but doesn't mean that you want to stop. Sometimes you may just have to tailor it down a little bit, maybe not do as many repetitions, or maybe do less intensity. Let's say if you're lifting with a 3-pound weight, maybe you need to bring it down to a 2-pound weight. So it's okay that your muscles become fatigued, and that's normal. And so sometimes you may just need to tailor it down a little bit and just adapt to your exercise program that you're doing at that time. And then pain, right? I know with pain, it's one of those things where, and this is natural for all of us, right? When we have pain, we don't want to move, right? You want to avoid the movement, and particularly within your muscles and joints, because it's painful. So a lot of times people will feel that if the exercises are painful for them, it's going to cause more damage, or it's going to increase the progression of the disease process. And I'm here to tell you that it does not do that. Now, are there times where maybe you might have did a little too much and you have excessive pain? Then yes. And that's where you may just have to tailor it down. But what ends up happening, though, I think, where sometimes people kind of fall into this cycle where if you have a lot of pain, you don't want to exercise because you don't want to cause yourself more pain. But when you don't exercise, you're going to just cause more stiffness, more discomfort. And so then you'd have more discomfort. So then you don't want to exercise. So in order to kind of break that cycle, I try to tell my patients all the time is that sometimes you have to just tailor it down a little bit. You may just have to bring it down, bring it a notch down, but don't avoid movement because it increases pain. Now, if you have excessive pain, then maybe you did too much. But movement is the key. You always want to keep movement, keep moving, keep that movement going. That is how you're going to help. Don't automatically just stop and not do anything, because you can always tailor it down. And so just some key takeaways: start early. I can't even emphasize enough how really working with the physical therapist can really help you to tailor whatever your deficits are, whatever's going on with you as an individual. they can really help you with that exercise program. So starting with physical therapy as soon as possible is definitely recommended. And then consistency matters. So even if you're seeing that therapist maybe twice a week, 3 times a week, you really have to take that ownership to do things on your own as well. So regular exercise is really, really helpful and can help with the disease progression and also maintain that current function that you have. Now, safety first, right? You always want to feel well during and after exercises. You can continue. Okay. And as you're doing a little bit more, you're going to be able to increase over time, increase your repetitions, maybe increase your intensity as you're starting to feel better. Like I mentioned before, during your flare-ups, that's when you might just have to adjust your intensity and time with exercise. That doesn't mean necessarily that you stop altogether, but you may just have to adjust it. And then just staying positive. I know that sometimes it can be definitely difficulty, especially when you're kind of focusing on what are the things that I can't do. One of the things that I try to tell my patients is try to focus on what are the things that you can do? What are the functions that you can still do well? And how can we help make them a little bit better? And how can we help to improve your quality of life? But just trying to stay positive, and working with that therapist on what your individual goals are. What is it that you want to do? Those are the things that you want to look at. And I try to tell people too is that, therapists, it's a team. We work together as a team with our patients. So we want to know what are your goals? Maybe your goal isn't to, walk down the street. Maybe your goal is to be able to just be able to walk to go get your mail, so that's where you have to really be, honest with your therapist. Tell her what is it that you want to work on, and that we will work together as a team to be able to figure out what are the goals that you want and what are the different things and what are the steps to get towards that goal, and how can we work together as a team to help you progress, but also maintain what you already have. So collaborating with your physical therapist, they will help you with that personalized plan. Okay. They're going to adapt your exercises to the needs and the stages of where you are in the progression of the disease. Education, we're going to help guide you on safe techniques and how to progress slowly, how to progress safely as well. And then also just give you that support, motivation, encouragement to stay active. So, try to figure out where's their therapist that I can see, or if you're working with them. Like I said, one of the main things is just to really work with that therapist to help let them know what your goals are and what are the things that you want to get better and what are the things that you want to do. And they really can help you a lot.
So, Clarisse, thank you, thank you. Ladies, now is the fun part. We're going to take all of that information and all the questions that you asked, and let's go into breakout groups so that we can talk about all of this in the breakout groups. And breakout groups will have about 7 or 8 people. In the groups, I want you to think about this, to talk about physical therapy. What are our experiences with with PT services? What are your personal challenges in using and obtaining PT services? And what should I anticipate in the future for PT services? So let's go into into breakout sessions and talk about our experiences, our challenges, and our anticipations for this. And as we go into the breakout rooms, when you go in, meet everyone in the room and try to seek someone to report. What we would like you to do is seek a reporter in that group that's going to gather all of your information. So when we come back, that person can share everything with the rest of us and Clarisse will be able to comment and hopefully give us some ideas and and answers to those questions. So now let's go on. We're going to create some groups and
Function. focus on function. There was a lawsuit a few years back that stated that Medicare is not able to deny somebody coverage for different chronic conditions. And one thing that we fought for, as with the APTA, and I know Justin, when he comes on, he'll probably be able to talk more about that, is that there is no more cap on physical therapy. There was a cap at one point for the money amount. There is no longer a cap with that. Now, I think the ambiguity and sometimes those gray areas, and I think the communication between a lot of clinicians, between different organizations, state to state, is that some don't realize that there isn't a cap, one. And then two is that they feel that, no, we cannot continue to see a person if they don't see any functional gains. So what I said, some of it can be on how therapists, how they document or how they word it. If a person, an individual is coming to see me and they they're having difficulty maybe standing up, they're having difficulty maybe maneuvering in their bed, there is still, or they're having just difficulty doing their exercises, there can still be medical necessity needed to help them with their exercises. Maybe they're not independent completing them. So there's different ways that they can word it to state that there is still medical necessity, even though they might not see major functional gains with it, that yes, I can still continue to see this individual because there's still medical necessity to do that. Now, the other thing is that sometimes, and this happens in the clinic that I'm at as well, is sometimes, because we've run into that issue where an individual, maybe if they take a break, let's say that, you're doing the therapy, maybe you just take a month off or something, but then you should be able to come back. And it could be within that same year. You don't have to wait until the next year. If they say, well, let's wait until your money starts over again. That is not the case. There is no money amount cap on Medicare. We fought that for many years. So it's one of those things where just talking, with your therapist, like, hey, I know there's no Medicare cap anymore. And that if there's a way that we can still show that I still need help, even with a chronic condition, you should be able to do it. Now, one other thing that I suggested in one of the breakout rooms is definitely call your insurance as well. You can call your insurance company and ask them, what are the limits that I have, if there's a limit, because sometimes people have, there's some Medicares that are managed care Medicares, you have HMOs that go with Medicares, or some people have secondaries. So sometimes there's limitations along those lines. And so you yourself would have to look individually for that, because I don't know for individual insurance companies what those limits could be. So you may have to also, I would just advocate for you, just call your insurance company to also find those things out. If there's with the HMOs, managed care, because those can be a little bit different along those lines, or secondary insurances too.
So, Clarisse, with that being said, it's a very, very important topic. Can you go back and just with those things, knowing we have so many people on in so many states, give us, who do we go to in the state? Who do you go to first? Do you go to your local state APTA? Do you go to your insurance company? Do they go to the organization? Is the wording changed from state to state also? So just to simplify it for other people, can we kind of give a simple outline what steps to take when we are told, oh, you only have 10 sessions or you only have X number of dollars?
I think
And knowing that it's going to vary, it's a national bill, but it does vary from state to state.
does. So I would say contact your insurance company and see what they say specifically so whether that's Medicare, and if you have a secondary, contact them. The other resource you can do is that the Physical Therapy Association, it's a national association, but we have state organizations for the Physical Therapy Association. So if you live in the state of Rhode Island, you can look up Rhode Island's American Physical Therapy Association. They should be able to also give you some guidelines for that state, for whatever state that you're in. So I would say call your insurance company And then you can also contact your state physical therapy association, because they should also be able to help give you some guidelines, because they have people that help with those different things. They can also help give you some guidelines along that line. Another thing that came up, and I'll just bring about referrals, because people had asked about how do you get a referral. You can get a referral for, now Medicare does require a referral from a physician. There are some states who have direct access, and Maryland is one of those states where you don't need a referral to go see a physical therapist. So depending on what state you're in, you may not need a referral to go see a physical therapist. You can just call. Sometimes it can be insurance-based too, so you would just have to check that out. But if you do have Medicare definitely does require a referral, but you can get a referral from any physician. That could be neurologist, it could be orthopedic, even a primary care physician can also write a referral for physical therapy. So that can be from different providers as well.
Okay, that's great. So are there, Martha or Clarisse, are there any other main topics you heard in other groups for us to start on before we go into some of the group questions?
One thing that was brought up too in the groups that we talked about was the different types of therapy that you can get. So you can get therapy in an outpatient clinic. You can also get therapy in what's home care. So if somebody is not able to leave their home, they would get home care services. Now, there's a lot of criteria with that. To get home care services, you have to be considered you have to be considered homebound. So what that criteria is that you cannot leave your home to go out for different things. You can't drive to go to the store, to go shopping, doing those things. You have to be considered homebound, where you can only go to visits for only doctor-related visits. So that would be considered for home care services. Now, they also have what's called outpatient visit in the home. So for people who need outpatient visits in the home, so that's someone who maybe has a difficult getting out, but they're not necessarily considered homebound. So a therapist can actually come to your home and give you therapy services in your home. One of the national PT organizations that do that is Fox Rehab. So that's one. If you looked up, if there's a Fox Rehab in your area, or any type of therapy clinic who does outpatient visits in the home. So that is definitely an option for people who are not able to go out to a clinic and to be able to do their therapy. So those are some of the type of different therapies that a person can get. And I know that did come up.
What about telehealth? Yes or no?
So telehealth is definitely an option. I will say that sometimes it's definitely an option. Now, you would have to just check with the different organizations. Some therapy clinics do it. Some outpatient clinics can do telehealth. Some clinics that with home health, you can even do that. That's one thing that was really fought, especially after COVID. It's one of those different tools that we can use, that I think that one of those good things that came out of COVID, where a lot of the therapists had to go to telehealth. So it's definitely an option. Would I say, is it better to have a therapist be able to come see you or go to a clinic? Yes. But if, let's say, you're in a remote area and there's no way that someone would be able to come see you, or sometimes you'll see where people will do it twice. They might go into a clinic and then they also have to do the telehealth visit as well. It's definitely an option. With the telehealth visit, the therapist is able to see how you're doing your exercises. They can kind of evaluate a little bit of what you're doing, how you're getting around your home or doing different things. So it's definitely an option for people who just don't have a therapist that can come to their home, or they're not able to leave their home to go to a therapy clinic. So it is an option.
Great, thank you.
So
So,
I have a couple
yeah.
things to add, if I might, from our
Sure.
group.
Absolutely. And which group, Sharon?
I was
Okay.
with Bev Reardon's
Oh,
group,
okay, great. Thank you.
and Karen Benson recommended Courage Health out of Texas for people with IBM. It's specifically tailored for people with IBM, I think, and MS too. And Joe Sanchez is the leader. I put that in the chat. It's a free program. Also, there's something listed on the TMA website. It's, I think, in an interview, and Karen can correct me if I'm wrong, but it goes through a list of swallowing exercises from Hopkins on that interview. And then I have also worked with Brett Burton. I think he may have even addressed this group. He does PT specifically for people with IBM. He works with you on an app called Somavive, and his company is One Harmonic Motion. And I put his email in the chat too. I worked with him for the better part of last year with the blood flow restricted exercises.
Thank you. Thank you. Were there any other comments in your group?
But I
Nancy?
can't see these, sorry, excuse me, but I can't see the messages on the chat regarding what she just mentioned.
We'll put them on there, and if you have any questions, we would just send it to me. They may not be, they're not on here yet, but we'll put when they come on.
Nancy, I don't
Sharon,
believe I have your email address.
okay, it's WomenWithIBM at myositis.org.
Thank you.
So,
Yeah, and if you can you just put this on that we put the Courage Health on here and Brett's
I'll email you
information.
the information so you can email people.
Okay, great. Thank you. Thank you. And which there's something from another group.
Yes, Nancy, from Group 4, this is Linda Hochfeld.
Hi, Linda.
Thank you, Sharon, for sharing the Courage Health. That also came up in our group that was shared by Dee from New York. And Courage Health is spelled, instead of courage with a
With
C,
K.
it's with a K.
Thank you.
Courage Health, that would be helpful. And what's nice, as Dee said, because she does not get to see a PT, she's moved here from London to New York. So it gives her, by joining this online group, it gives her accountability, and also something that allows her then to do something every day. So you don't not do something. So it becomes very routine. But she also had another great tip. She suggested, because many of us cannot get down on the floor and have that harder surface to do exercises on, she uses a physio board that she just allows it to lay on top of a bed that she is not using. So she never has to lift it off, put it back on all the time. But that really does act like a floor. And if you need something softer, one of our members said, just put an exercise mat on top of it if you need something to soften that. But all of our members found PTs and OTs very beneficial, very helpful. And many account they're using PTs and OTs, keeping them stronger, because if they ever stop, they knew if you don't do it today, you will be weaker tomorrow. And I thought that was a wonderful thing to share with all of you. That came from our group. Thank
Can
you,
you
Nancy.
Oh, you're welcome, Linda. Can you put that comment in the chat? That's great.
Yeah, I loved it. And that's from Dee from New York. She
Thank you.
gets that one.
Thank you,
Louise,
Dee. And I was gonna say too that that this is great that everybody is sharing this information, because this is so helpful for everybody. And I know one of the questions that came out in one of the rooms that we had was also, how do you educate, like what do you tell your therapist, or where to send resources? And so this is great about this Courage Health and some different things. And I had also encouraged people just to send them to the myositis website. There's so many great resources on there, between videos and exercises and different things, if they're just not familiar with it, with IBM, with a lot of therapists are not, I'll be honest, but I said most therapists are definitely willing to learn, so I think if they're, and willing to do the research. Again, we are all doctors of movement. We know muscles, we know joints, we know nerves, so we can still assess what are the deficits that you have, but definitely, sharing those resources with them. Most therapists are very happy to learn more about it.
Great. And who else would like to share? You guys are quiet. Any other comments or questions?
This is Christine from Tampa, Florida.
Yes.
I had Yeah, hi. I had asked my group about when I go to physical therapy. A lot of and my doctor, they told me that they can't give me any medication, the prednisone, because it wouldn't help me. But most of the ladies in my group said they are taking prednisone. So what is the I recently moved from New York, and my doctors in New York told me the same thing. So I don't know whether they put me off or what, but what is the criteria to get your doctors to give you medication? I'm far gone because I can't. I'm using a wheelchair only because I fractured my ankle, and like you said, if you don't use it, you lose it. So I went from a rollator to the wheelchair. So now I'm so afraid to walk on my own now outside. I walk with a walker in the house, but I'm afraid to walk outside without my wheelchair. I mean, go outside without my wheelchair. So but I was told that they wouldn't give me prednisone. So what is the criteria where you can
Well,
get medication?
Christine, that's something
Yes.
unfortunately we can't, we don't have answers to.
Okay.
I would just suggest, one doctor, maybe a second opinion or a third opinion with the doctors. But I think Clarisse would talk about exercises in your wheelchair that there are some things that can be done. Do you want to address that, Clarisse?
Yeah, so definitely,
Mhm.
sorry to hear about your fall.
Thank
But
you.
there are definitely things that you can do in the wheelchair. There's arm exercises you can do. There's some leg exercises that did you see a physical therapist or have you seen one since the
Yes,
fall?
I've seen physical therapists. I mean, I can walk. I can get out the wheel. I'm not
Yeah.
wheelchair bound.
Yeah,
Just that I'm afraid because of the fall, and I have osteoporosis. I found out I have osteoporosis, so my bones are always fractured.
okay.
So
I
yeah,
was
but I
just
can walk, but I just
okay.
can't. I'm just afraid. I don't have the balance.
Right. So definitely just with physical therapy, they can definitely help you with your balance. They can have you, whether you're doing exercise in the chair, whether you're doing standing exercises. And I know that it can be difficult once you have a fall. It's just that fear of not, happening again. So working with
Right?
a therapist, they can definitely help you with any of the deficits that you're having so that you can
Yeah,
get back better, a little bit better.
but my problem is I'm not sure if everybody has the same problem. My problem is my knees always buckle.
Right. And
Is that part of the IBM?
yes, so having the weakness in the front of your thighs, your quad muscles, that is definitely an issue that is seen for most individuals with IBM. So there are specific exercises that you can do to help that that are in the chair, could be with standing, all of that. So I would just highly recommend if you're able to have a therapist, whether it's coming to the home or you going out, that might be helpful for you, and they can help you with all of the deficits that you're having.
Okay, thank you.
Mhm.
Right. Any other comments or
I
questions?
yes, I just want to say about the buckling. I had it for many years for my IBM started. But let me tell you, physical therapy and being on a bike that has it's a exercise machine, that it has an arm that moves your hand, and it moves my legs. I do not feel buckling anymore because I have a lot of strength in my thighs, and down there I do a lot of lifting with my legs. Even when I'm sitting, I will just do like up and down. It has
Okay.
done tremendous for me. Just
That's great.
yeah,
That's wonderful.
yeah.
Okay, so as we were finishing up, we've got about 10 more minutes. Do we have any more questions or comments from the rooms?
Nancy, there were a lot of questions in the chat early on. And also when we registered, I think people put in
Yes.
questions. So can you ask Clarisse to address those, please?
Yeah.
Let me look at some of these in here.
So Nancy, it's Martha. Some of the questions in the chat, Clarisse has recently addressed these last discussions about PT online and finding a PT that knows IBM.
One other question is house cleaning considered exercise?
So definitely, so right. I know we want to incorporate exercise into anything, right? So what I tell people is movement is good, right? Any
Yes.
type of movement that you're gonna do is helpful.
Yes.
So whether that's house cleaning, whether that's, you know, walking, it's all good. But the main thing is that you want to be able to do movement that's increasing your heart rate. That's usually the key. So if that's why I always suggest, if you have a Fitbit, Apple Watch, something that's gonna kind of measure what your heart rate is. And do you feel tired after you do it? Are you able to still talk after you do the house cleaning? Because if you want to be able to, where you are kind of, you can feel your, you know, you're breathing a little bit heavier, that's where you know that your heart rate has gone up. You want to be able to exercise, like, or let's say you're doing house cleaning, you're doing different things. Again, those guidelines are, you know, 20 to 30 minutes of intense exercise, intense activity. So yes, so yes, you could do some of that as far as aerobic exercise if your heart rate's going up. But you also want to be able to incorporate maybe some resistive exercises. And that would be the strengthening things, whether you're using bands, whether you're using weights, those types of things as well. So I would try to incorporate that too. And walking is good too. So to answer the question, if your intensity is going up as far as your heart rate, yes. But also we would want to incorporate other resistive exercises and whatnot. And I tell people, find things you enjoy to do. Dancing can even be a form of aerobic exercise, you know, so whether that's dancing, swimming, walking, water aerobics. I know somebody brought something up about water exercises and water aerobics. That can also be a good thing. In particular, sometimes when someone's having a lot of pain, doing exercises in the water with the warm therapeutic water, if you have access to that, is also a good option too. If that's if somebody's not afraid of the water, they're able to do different things. Having a therapeutic temperature in the water can be very helpful for that.
Great.
Great.
And I see Sarah has, I know that you, Clarisse, going over all the questions, have pretty much answered a lot of the questions that were on there, because in general going through. Sarah has her hand up.
No,
Oh, no?
no,
Okay,
no.
that was me.
Sorry.
Did
Okay.
someone? Okay,
I do see
so
a question
ladies,
about Pilates, saying is Pilates good for IBM? Most definitely. I think somebody else talked about that their therapist had them on the different Pilates machine, the reformer and different things, but yes. One of the questions I remember that was in the previous asked questions before the thing, they were asking about core exercises. Core exercises can definitely be helpful because your core is kind of the center of your gravity. So any exercises, whether it's Pilates, whether it's yoga, because sometimes even yoga is not just about flexibility. A lot of it works with your core muscles. So those can all definitely be very helpful. So yes, core exercises can be very helpful in addition to, you know, any of the leg exercises or other things that people might do.
Great.
Miss Clarisse, can you hear me? I never speak. My name is Velma McClellan. I never say anything. I enjoy the sessions, but may I ask you a question if you can hear me, please?
I can definitely hear you. Sure.
Good afternoon, everyone.
Hello.
My question is, and I've listened to all of you on the session today, and I was diagnosed in 2019 with IBM. As recently as last month, it has now become IBM and the skin rash. I suffer with all of that. I've been on the prednisone. I was on prednisone for 3 years. Now I'm on the methotrexate, but I was recently my insurance company recently approved me. I am going to start having the infusion treatment next week for IBM, the Gamex infusion. But my question is, should I continue to have physical therapy along with getting this infusion treatment twice a month for 12 months?
Yes, so definitely while you're having the infusion, definitely you can still continue to do the physical therapy, because that's going to just even help in an adjunct to the infusions that you're having, to help with the strengthening, to help with your balance, to help with coordination, all of that. So most definitely, you can definitely still continue to have the physical therapy while you're doing that. I mean, and you can always check with your physician, unless you're
Yes.
in specific. I would always check with your physician, but my experiences, I believe that it can definitely still be safe while you're doing it.
That's great, because my children said, "Ma, getting the infusion without the physical therapy is not going to help you that much. And they wanted me to make sure that I can get the physical therapy. And my physician that has ordered me to get this Gamex infusion did tell me that I could go into physical therapy, but I don't leave home unless it's a doctor's appointment. So I will have to have them come into my home because it's so difficult for me to go in and out, get in a car, getting out. It takes me long enough to get in a car as it does the entire appointment. So
Yep.
Great.
So as long as you're there, your doctor writes a referral for home care, or whether it's or outpatient visits in the home for physical therapy, you could definitely do it in your home.
thank you very much. I
Thanks.
appreciate it. Thank you so
Okay,
much.
so I think we
Can
have
I ask you-
time, ladies, for one more question. Do I see here? I see one question or two. Okay, these two,
One.
Carolyn first and Rima second.
Okay, it's not really a question. I just wanted to make a quick comment based on people talking about getting prescriptions or infusions. I thought that basically for IBM, there is no medication to be given.
Carolyn,
I was told the same thing.
Okay, as Velma said, she has IBM, but apparently she has some other what they call crossovers where she's been diagnosed. So frequently we see that happens. And we're not the doctors, we don't know, but we have to leave it in their hands.
Another quick question. Actually, this is for Clarisse. While I'm talking to you, I'm using one of those electric foot pedal things. Are those anything worth doing? Keep your legs moving?
They definitely can help you. Yeah, because somebody else I think asked about that, the different lower extremity or the ergometers or bikes that you can do. Those are all definitely very helpful. Anything that keeps your legs moving and going, it can definitely help. Now I know somebody had asked about specific ones. I can't say for specifically which one that you should get. There's a lot on the market. I always tell people definitely look at the reviews, and see what people are saying about them, because I can't say specifically get this one, but they are definitely helpful. Yes, keep it up.
So
Thank you.
let's go with Rima. I see Chris, and we have about 3 minutes. So Rima.
I just wanted to ask if does the TENS machine help to build up the muscles, to activate the muscles?
So there are TENS units there's different ones. There's some TENS units that help for pain. There are some electrical stimulations that help to kind of stimulate the muscles. You know what I have found a lot of times that people will use them, but I feel that sometimes people will use it in the clinics to help increase it. But I think just doing the exercises, I think itself is good enough, honestly, because there's a lot of different, again, this is one of those, there's a lot on the market with different ones, and there's a lot of them that promise, they used to do these ab ones, they'll promise you to have a 6-pack if you use these TENS unit. So there's a lot on the market that are there, but honestly, if you just do those exercises, in particular ones that we've talked about or that your therapist has prescribed to you, those usually are enough.
And I
Okay.
wanted to just ask one more question, which is not related to this, but the same what Carolyn had a question. Do these IVIG infusions help? Because I was also thinking of trying them out.
Rima, that's something that we don't know. You have to ask your doctor about.
I think Chris was saying that she
We
just
can't,
tried.
that's something that's prescribed by the MDs. So Clarisse is not going to know. You're going to have to go back to your doctors about that. Okay. Chris,
Clarisse, can we have your email address? Can
Chris.
I have your direct email address, please?
Sure,
Okay,
I'll put it on the chat.
Okay, great. And
Yes,
Chris,
please.
this is the last question,
Yeah,
and
okay.
ladies.
Okay, can you hear me? I just want to ask about ankle roll and if AFO helps with that, or if there's any other kind of support that would be helpful. I don't walk very well, but I walk inside with a walker, and I have a lot of trouble with my right foot rolling.
You had said the ankle roll. I'm sorry, I didn't.
Ankle roll, yes. My foot wants to roll to the outside.
Oh, okay. So yes, an AFO. So you're asking if the AFO could be helpful for you? I'm sorry.
Or another type of brace.
Yes, so they definitely an AFO, which could definitely help with that because it'll help to position your foot. In particular, they call the ground reaction force one. So ground reaction force AFO.
Okay.
Again, that when you step on the heel, it kind of helps to bring that foot up. But what also may be helpful is if you talk to your doctor about that, they can usually either give you a referral, have you talk to an orthotist. So an orthotist is the ones that usually will prescribe the orthotic, and they would be able to help you specifically for whatever's going on with your foot.
Okay, thanks very much then.
So, ladies, I'm gonna say, I'm gonna say thank you. I think we're still sharing. I'm not sure. I'm gonna say thank you all for coming. Please, thank you for being
Thank you.
here and enlightening all of us. Martha and Pam for stepping in at the last minute. And our next meeting will be in February 18th at noon. We're working on a program right now and in March. So in the interim, if anyone has any questions, please contact us at Women with IBM at,
He wants to buy some, there's no dishwashing liquid. Where is it?
okay.
Oh,
No dishwashing liquid. Women with IBM at myositis.org. And with that, ladies, I'm gonna say thank you, and we will see you next month.
Thank you
Okay.
so much, ladies.
Thank
Good
you.
luck.
Thank
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 you
you,
for
Thank you,
Clarissa.
Nancy.
So
Keep
much.
moving.
Thank you,
Keep
Nancy.
moving.
Keep it moving.
Appreciate
Thank
it.
you. Thank you, guys.
Keep
Thank
moving.
you.
Thank you. Come on.
Hello.
Yes. Okay.
That was great, Nancy.
No, thanks, Pam.
Thank you, Nancy. That was great.
No, you're welcome. I'm sorry. I was a little rusty. I wasn't sure on the breakout rooms. We couldn't get a handle on, normally you can set it for a time, but we couldn't. So I had to kind of give you guys 60 seconds, and it was not smooth, but at least we went well. Um I saved the chat. And Martha, Pam, any comments?
Just
Excuse
in
me.
terms of the chat, one thing, there is one question that didn't get addressed, Clarisse, it's very specific. It had to do with, is there a recommendation for a different target heart rate if someone is on a medication that actually controls their heart rate?
I could
So
definitely.
I captured the name of that person, and I'm not quite sure, Nancy, what your policy is about individual follow-ups or
I'm happy
kind of
to
how you deal
follow
with
up.
that.
I'm happy to follow up. We do have emails, but that's all we have.
Okay.
So yeah, if I actually just saved the chat. So Clarisse, I can send it to you and we
That's
can go
fine.
from
I
there.
can follow up. Yep.
Okay,
And
I
so,
appreciate that.
Nancy, there are some other folks who are still on. I don't know if they're on because they're interested in speaking with Clarisse
Yeah.
or kind of what the deal is, but did
I
want to let
am.
you know that there are 5 other people.
My name is Sarah, and this is my first time. I'm just trying to find out how to get on the chat. I want to get the.
Sarah, if you look, there should be a line on it. There should be a bar. It'll say chat. If not, send me, the easiest thing is send an email to womenwithibm at myositis.org, and I will be happy to send you a copy.
Can we,
Okay?
can we get this, this chat on that same website?
No, ma'am. I have to
Oh,
email you the chat. I can email the chat. Yes, I'll
okay, all
email
right,
okay,
Thank
Clarisse,
you
all
so much.
right.
thank
I'm
you.
gonna have to, I unfortunately have to get off. I gotta go
You
back to
know,
seeing patients, but thank you so much for having me. But
thank
Bye.
you.
we can definitely
Clarisse,
follow up.
let's follow up
Yeah,
Justin, we
Justin,
need to
we'll
follow
get
up
him on here.
on and
Yes,
do a
Okay, that's fine.
meeting for more than just this group on all of the legislation because he can
yes,
talk about it nationally.
we can definitely
Okay,
do that. All
thank
right.
you.
Thank you
So
all. Thank
you're
you,
welcome. Okay,
Clarisse.
Martha and Pam, what we're gonna do is when Clarisse, um, Clarisse is a Maryland representative and does stuff with the American Physical Therapy Association, but also works with Justin Moore, who is the president of the National Association. So he's the one who, if we want to follow up on any